views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of Bronxnet or the program underwriters.
Welcome to Public Health America, a 30-minute program on Bronxnet where we talk with national experts to promote health and social justice. I'm your host, Dr. William Latimer. We begin by focusing on a current health topic from the COVID pandemic to cardiovascular disease. Our goal is to provide you with not only the best science, but practical tips to live a healthier life. On Public Health America, we also celebrate what studies have long documented, namely the unparalleled value of a college education by setting the stage to pursue a career of your choice, increase lifetime earnings and opportunity, and champion the ability to engage in civil debate. But for many, finding a path to college is neither clear nor certain. What if you're a high school student with supportive parents, but feel daunted by the prospect of being the first in your family to attend college? What if you're a single mother or father and want to attend college, but have no childcare? On Public Health America, our expert will also talk about decisions they made and support they received that helped them beat the odds. By sharing one or two life lessons, their stories may provide you with the inspiration and method to realize your dreams. This is Public Health America. Welcome to Public Health America. I'm your host, Dr. William Latimer. It is a pleasure to have Dr. Rafael De La Hoz, a pulmonologist and internist and professor at the Icahn School of Medicine at Mount Sinai in New York City. Rafael, welcome to the program.
Thank you.
So, Rafael, I know you've had a career doing some excellent work on chronic diseases in populations during their work years. Talk a little bit about the chronic diseases you've worked with and a little bit about your work.
Well, I train in internal medicine. That's what I came to do in the United States, originally from Colombia. And one of the things that I noticed working at a public hospital in a large metropolitan area, say Miami, Florida, was that in internal medicine, although I love the chronic diseases, most of the time we were getting there too late for most diseases. So if we could see patients probably when they are not sick or when they are barely starting to get sick, we would actually have at least some potential to reduce the effect of those diseases. So that's how it started gravitating towards occupational medicine, because of course we see people during their working years.
Got it. So how much of that is preventative medicine and how much of that is treatment? Is that a fair question?
Yes, occupational medicine is a specialty that's not very well known in this country. There are only 70 to 80 graduates every year in the whole country, and that's a very small number. And it is definitely, the board certification is under the American Board of Preventive Medicine, so that should tell you everything about it. It is definitely considered a preventive medicine specialty par excellence, as they would say.
Sure, that's very helpful. So are you working with populations that have chronic diseases to prevent worse outcomes, morbidities over time? Or are you working with the general population to prevent chronic disease, or both, or I'm just missing the boat? What's your focus?
To the extent possible, both. I'll give you just a classic example. There was a realization, everybody has heard about black lung, and there are programs in place by the federal government and multiple agencies to try to do surveillance, vigilance, early detection, and the idea is precisely to diagnose those disease like black lung, which is coal dust induced lung disease, before it becomes a disabling disease. So it's a good example of that and what occupational medicine and doctors try to do.
Give me a sense, set the table in terms of just prevalence. What are the chronic diseases, or is it a fair question to ask, what are the top 3 to 5 chronic diseases plaguing the U.S. today, and does that impact where you do your work, or are you doing more specialty work that could be low prevalence diseases but still obviously affect the lives of people?
So I would say the classic big three are the number one, probably skin diseases. They have decreased significantly precisely as a result of a number of preventive work that has been done over several decades. The number two is probably musculoskeletal conditions like carpal tunnel syndrome or repetitive strain injury, and lower back problems and all of that. So those are musculoskeletal conditions. I would say they are the number two. And the number three, I would like to think that is respiratory diseases that are result from inhalation of toxic substances in the workplace. And that's where I come into place. And so those are, but there are many organs can be affected by occupational toxicants, like the liver, for example, with chemicals, and the kidneys with metals, and so there are a number of other organs that can be affected. So that's where we come into place and have to have a broad view.
So I want to stay on that excellent response for just a little bit. I'm going to start with the second one, and I'm going to focus on lower back pain. So you've educated us that the occupational work that you do is preventative in its nature. We all know, or it's widely known, and we've certainly had plenty of guests that have talked about the obesity epidemic in the United States. And when I think of lower back pain, I think, to what extent is that related to weight? And is there a moment in that occupational approach that is looking at healthier living, healthier eating, et cetera, as a preventative way? Is that an approach that's in there at all, or is that a separate field?
Well, initially, if you go to classical occupational medicine, let's say 50 years ago, not so much of that, but as a result of a number of circumstances that would be kind of too long to analyze, including the obesity epidemic in this country, there was a realization that it was necessary to work also on factors and comorbidities like obesity and others that would have a modifying effect, and certainly not a favorable one, on the evolution of those chronic lung diseases. And just the biggest example that I could give you, just off what I'm doing right now, in the follow-up of the cohort of the World Trade Center, obesity, I've been calling attention to the fact that obesity is a major factor. The World Trade Center occupational cohorts are more obese and overweight than the general population of the United States. So we know that obesity affects lung function. So if I am interested in airway disease, I couldn't possibly ignore the role that obesity plays and other factors related to general health. So yes, definitely, it plays a role, and we would fail miserably if we didn't take it into account.
That's very helpful. And to follow up on your third point, and it's an area in which I'm not very conversant. When we look at, if I got the point right, environmental toxins in the workplace are a major cause of chronic disease and/or disease generally. Is that the point you were making?
Oh yeah, and definitely being made by many. There is a huge amount of research right now being produced about environmental as well as occupational factors. Yes, absolutely. Yeah, on many chronic diseases, including some
So,
that you wouldn't think. You think that obesity is related only to the tablespoon, and it turns out that there are toxicants in foodstuff and in the environment that actually are also determinants of obesity. So, yes, the answer is a categorical yes.
so where I was going with that, and thank you, that's helpful, is just give us a rundown. Like, the things that come to my mind is, are there variations in environmental toxins in different workplaces, or urban workplaces, or old buildings, or like, what are the predictors that would be relevant to understanding, if you as a person working uh, were at risk to be exposed to environmental toxins? Because my guess would be you wouldn't know, right? I mean, you're going to work and you wouldn't know that exposure existed.
Yes, part of our work is to actually try to make people uh, know more about what they are exposed to. I saw yesterday somebody who is a glass blower, and a successful one. And he has people working under him. And he has been doing this for about 20 years. But he actually, at this point, although he has some idea that certain things in his work environment are toxic, he actually doesn't have a detailed knowledge of each and every one of them. So we actually, part of my work is, of course, first make sure that he doesn't have any disease. He was referred to me because he has some breathing issues that I'm investigating. But then we had to take a step further and actually have him work with an industrial hygienist and myself to try to characterize the exposures that he has, because it would not only benefit him, it would benefit those under him. He probably subcontracts people or have some, he has a workshop. It's not just him. And so that gives you a picture of, how we go about, investigating these cases. If we just said, well, you're here, your x-ray is normal, your breathing test doesn't seem to show anything, I don't need to see you anymore, we wouldn't be doing not even half of our work.
Sure. Fascinating stuff. And, clearly, it may not be widely known, in a lay audience, but environmental factors have just such an enormous impact on our health and well-being. And yet, on a day-to-day basis, how many folks walking down the street are thinking about that? I would imagine that policy is so important in terms of, requiring workplaces to be safe. We have just about 30 seconds left in this first part of the segment. Rafael, what is sort of the key focus of your work today? That might be too narrow a question, but what do you see as a key next step in terms of this work you're doing?
Well, what I dedicate most of my time in research is in understanding all the diseases of the airways, of the respiratory system in the World Trade Center cohort, because we have a large cohort that we follow at Mount Sinai, more than 20,000 individuals. So we are looking at the confluence of factors like lifestyle, like smoking, occupational, like what the exposure of the World Trade Center and their exposures from their trade and occupations before, and obesity. There we go again. So yes, that's exactly the type of work that I'm interested in doing, and trying to understand the interaction and the of all of those factors in causing disease and aging in this population. So that's exactly what I do.
That's great. We're going to take a quick break. When we return, Dr. De La Hoz will tell us a little bit about his life story and how his undergraduate experience set the table for his subsequent medical degree and the great work that he's doing. This is Public Health America. I'm your host, Dr. William Latimer. Welcome back to Public Health America. I'm your host, Dr. William Latimer. So, Rafael, what we do in this second segment is we try to get a sense of, the life trajectory of people like yourself that have really amazing careers and they're doing incredibly exciting things, and sort of understanding how formative experiences and college sort of set the table. And I always start with the same question, which is, where were you born and what were some of your formative experiences?
Well, I'll try to keep it as short as possible because for somebody who has had the kind of trajectory that I've had, you will see in a second, I'll have to skip a lot of detail. I was born in Colombia, in the Caribbean part of Colombia, but when I was 3 years of age, my parents moved to Cuba, and I went to primary school in Cuba. My mother was a nurse, and my father an electrical engineer, and we lived there for about 7 years before coming back to Colombia. And that's where I did most of my secondary high school years. And then I moved to Bogota, the capital of my country, to go to university. And so that's how that trajectory included three major cities in South and in Central America, and so it definitely didn't like diversity. In the process, I went to a public school in Cuba. By definition, all schools were public at that time, and then I went to a boys' schools, a Catholic school, with priest and everything. Then to a school sponsored by the Protestant churches of my home city. Then to a public university, and then to a private university. So it's as I said, variety was certainly not lacking.
That's amazing, and that's great. When I mean, we, I see your point. I could imagine spending, a significant amount of time talking about any one of those chapters, and the fact that you had the opportunity to spend time in Cuba, probably well before anyone was having any kind of access, meaning from the United States anyway, would be a story unto itself. So your dad was an electrical engineer, your mom was a nurse. It sounds to me like the trajectory to university in Bogota was sort of probably very much supported by them. Is that a fair statement?
They definitely were obsessed with education because both of them, my mother was the oldest of six, and my father the oldest of four, and they were the only professional people amongst their siblings. And their success in life was because having taken a risk and really advanced their education.
That's great.
That's
No,
exactly
that's
what they did.
wonderful.
Yeah.
Yeah, that's an amazing story, and I appreciate the emotion. Clearly they, I mean, for what it's worth, there might not be every parallel, but while I've never said this quite the same way, my parents were absolutely obsessed with education. And I'll share a very quick anecdote. When I wasn't going to go to college, my dad, who never prescribed anything, he was very let them figure it out on their own, sat me down and said, maybe you should just go and try it out, see what happens, and we'll take it from there. Because he knew intuitively if I didn't go, it would be a disaster, and he knew that if I did go, that I'd probably end up loving it, which I did. So, let's just agree that we both owe a lot to our parents. Tell me a little bit about University in Bogota. It's a big city. It's a great city. I know a lot of people there. I've had some fellows from there at Hopkins. What did you major in, and what was that experience like?
Well, what happens is that for in my country, the Caribbean region from where I am is very different from the highlands where Bogota are located in the plateau on the Andes Mountains, and racially and culturally is very different. I was never more a foreigner than I was when went to Bogota. The rest
Mhm.
of my life as a foreigner, and I'm still a foreigner, and I will die a foreigner. Uh, it was made easy by the training that I got in Bogota. So it was extremely different, but it was a city that it still has. It's about 8 million people. It's about 8 times larger than my home city. So it was a tremendous expansion of the horizons, despite all the immense challenges of living there. Uh, it was a tremendous expansion that and in a way I focus on what it was giving me and trying to handle at the same time the immense challenges that I had as a person who was not liked. So there were, it was a balance, it literally. On one end, I knew that I was getting exactly what my parents said that I could get from a city with immense resources compared to my home city. But on the other hand, I was dealing with the tremendous challenges of dealing with a society that at that time did not like those like were like me.
Mhm. So let me ask this. So you've just outlined a very significant dichotomy where you recognize, or I hear in your words, a recognition of value and opportunity that you wouldn't have gotten elsewhere, and yet equally uh, very significant stress associated with whatever racial or ethnic or whatever issues were going on that you're alluding to. Let me ask you this: were there any protective factors that help you work your way through the negative side of that, or were you just kind of on your own?
Well, the the relationship with those with my parents, uh, with my siblings, yeah, and my family in Bogota. I had an uncle there, so I was able to identify those people who really matter, and I was
Got it.
able to focus on that I really was pursuing, and I was bedazzled by the opportunities that I had there, and between that and identifying those key people that I navigated the situation, and I think successfully.
Sure, that's great. So let me ask this: you finished your undergraduate degree. Um, at what point did at what point did you emigrate to the United States, or did you go somewhere else first, or where did you do your medical degree? What Walk us through that.
My father had trained in the United States, so somehow we had a sense of the possibilities in the United States in terms of academic development of the great institutions of learning of this country. So I think that psychologically, I started traveling to the United States like 3 years into university. I said,
Got it.
I want even more horizons for myself, and I'm going to start writing letters and just sending inquiries as if I were going to graduate tomorrow. And I was about 3 years away from that degree. And I started inquiring into it, learning the language, which was very difficult from Spanish to English is quite, a step compared to other languages. I learned French in about 2 years. English, I think I'm still learning. So that was when I started thinking about it, and that was the consideration, the further expansion of those horizons.
That's great. And where did you go to university or college in the U.S.?
That I came for graduate training after having received my medical degree and having worked 1 year to get my license in Colombia, and
Yep.
start the process. And I went to the University of Miami to work at a public hospital, Jackson Memorial Hospital, and that's where I did my residency in internal medicine.
I was just about to ask that question. Okay, so you did your residency in Miami,
Yes.
and
Yes.
and and then went from there. Great, great. And were there, when you landed in Miami, was it in what ways was it a slightly different environment, or did you still have that sense of separateness that I think you were defining in terms of Bogota? Was it better, worse, different? What was that like?
Well, it was a sea of change because it was an entirely different culture, and but by then I think I had the elements of what the resources to really navigate, because it was a navigation process and it still is. So I had those. I had developed them by having been a foreigner in my own country, and so I sailed through, and it was a huge challenge again because I was coming to a city that in those years, 1985, was swimming in the HIV epidemic, of which there hadn't been a single case in Colombia at the time. Of course, there were after that, but you can only imagine now living through the COVID pandemic. For those who might not remember, that HIV before was just about a terrible epidemic, and that was particularly affecting the people who were seen at a public hospital in a major city like Miami.
Sure, sure. Yeah. I mean, when I was at the University of Florida, we did a fair amount of work in Jacksonville at a really great clinic run by some really wonderful people uh, that was focusing on treatment for HIV. And that was around the time that antiretrovirals were becoming more accessible, but still at the beginning phases of that. I mean, when you look at the World Health Organization, they still list HIV in the top 10 sort of worldwide, highly significant problems associated with mortality because, antiretrovirals still aren't accessible to millions of people that
Yeah.
need them. Um, so, with just 30 seconds left, if you had to give one piece of advice to a young person who's thinking about whether or not to attend college in the Bronx or anywhere else, what would that piece of advice be?
Never stop thinking of ways to expand your horizons. Is a very interesting world, and you should
That's
always
great.
look for that.
Wonderful. Well, I want to thank Dr. De La Hoz for joining us today. I want to thank our viewers for tuning in. I'm your host, Dr. William Latimer. This is Public Health America. See you next time. Take care.
Thank you.